how could we not be inspired? It's my privilege now to welcome to the stage Dr. Myrna Velasquez, who's traveled from Manila with her husband Ray to receive this International Inspiration Award in Faith and Health this evening. Please come forward. It's my final privilege this evening to ask Myrna to accept a $10,000 check from the Methodist Healthcare Foundation and Methodist Healthcare. I want you to know that this is a sign, a tangible sign of the respect that we have for what you have done to inspire us. Please know that these funds are just a symbol of our sense of shared faithfulness in a journey towards excellence. Thank you.
Good evening to each and every one of you, and mabuhay from the Philippines. I bring you the greetings of the entire staff of Mary Johnston Hospital in Tondo, Manila. I was gently pressured last February by Dr. Cherian Thomas of the Health and Welfare Ministries to visit their office in New York and at the same time visit Methodist hospitals in the United States, specifically the New York Methodist Hospital in Brooklyn, New York, Sibley Memorial Hospital in Washington, D.C., and the Methodist Healthcare in Memphis. I was at first hesitant to go because there were a lot of problems in the hospital. But the Lord made things easy for me, and hence the trip. I came, I saw, and I was conquered by the Methodist healthcare system. Your generosity and kindness will always be appreciated and remembered. And the many things I learned during the visit would be implemented in our institution. With gratitude and deep humility, I accept this Living Award for International Inspiration in Faith and Health on behalf of the hospital's Board of Trustees and Management. As you have seen, Mary Johnston Hospital was founded in 1906 by a kind-hearted missionary physician, Dr. Rebecca Parrish, whose lifelong ambition was to be a missionary doctor. The name Mary Johnston was also in memory of a missionary wife of Mr. Daniel Johnston. These are historical facts, but these are binding facts making the connection between Mary Johnston Hospital and other Methodist hospitals abroad, the United Methodist Church being globally connected. Mary Johnston Hospital feels deeply honored with the linkage that has been started with the Methodist healthcare. While we pale in comparison with your physical structure and state-of-the-art equipment, we share the same ideal of sharing God's love by being a center of wellness and excellence in the health and education ministries. We know you are miles ahead of us in this endeavor, but slowly and surely, we are following. Our hospital, which is one of the few remaining mission-oriented hospitals in the Philippines, celebrated 100 years of faithful and dedicated service in the community last December 10, 2006. We are even older than the Philippine General Hospital, which is the largest government hospital in the country. And despite limited resources, Mary Johnston has gained national distinctions through the past years. It pioneered in the field of family planning in the 1960s and started the first sterilization clinic in the country in partnership with the Johns Hopkins Hospital. This service was not only in the community but was extended in the whole country. Some of you may be Masons in this group, and you might be glad to know that our Masonic ward for crippled children, established on September 21, 1925, is the oldest existing institution aimed at alleviating the problem of crippled children in the country. It is the proud recipient of the prestigious Apolinario Mabini Award in the Rehabilitation Volunteer Group category, given by the Philippine Foundation for the Rehabilitation of the Disabled, with no less than then President Corazon Aquino giving the award. The National Historical Institute recognized the hospital as a historical landmark in the city of Manila. This was on June 20, 2002, and this was in recognition of the work that the hospital has given to the community. The Department of Health and the National Institutes of Health cited Mary Johnston Hospital as an outstanding newborn screening facility and exemplary newborn screening facility, respectively, in the private tertiary hospital category in 2005. Our Department of Pediatrics has been cited for its advocacies in children's illnesses and has been chosen as one of as the only institution in the city of Manila with a comprehensive community program. The hospital, though in financial difficulty most of the time, has continued to serve especially the poor patients. And this is done without discrimination. Our charity or our service cases lie side by side with our paying patients. As you saw during the presentation, there were several suggestions and overtures in the past for Mary Johnston to transfer to a more affluent site. Of course, if you transfer to a more affluent site, you will have more paying patients. But the answer has always been a no, because it is in Tondo where the mission work is. This award inspires all of us to give our best in service in the spirit of the great physician. Let me repeat the words of the late President Elpidio Quirino in his message during the inauguration of the rebuilt Mary Johnston Hospital on August 26, 1950. I wish there were more hospitals in the country that could render so much service as this hospital has rendered. These words remain true to this day. Let me share this award with each of you who continue to share your life with patients with the physically ill. To each and every one of you, this award, thank you very much, and to God be the glory.